Okay, hi there. Welcome to my lecture today. I'm going to talk about treatments and technologies of cardiovascular diseases. And my name is Dr. Samuel Muyanga. Basically, cardiovascular diseases are one of the most important non-communicable diseases. If you look globally, it's one of the top 5 diseases that cause most of the deaths globally. And if you look at the South African disease trend, it's been shown that in recent times, non-communicable diseases actually have risen way above communicable diseases, in the sense that non-communicable diseases actually claim more lives than communicable diseases. As you can see in the graph here, 57.4% of deaths are caused by non-communicable diseases, as compared to 31%, which are caused by communicable diseases. Now, why is this shift happening like this? There are a couple of reasons. But now the purpose is not really to go through these papers, but it's just to understand that there are interesting trends, and these trends basically have resulted into increased deaths as a result of non-communicable diseases. And then if you look at the top 10 causes of deaths in South Africa, and if you compare between 2015 and 2016 statistics, you will notice that among the top 6 causes of deaths, majority are caused by cardiovascular diseases. For example, diabetes, other forms of heart diseases, cerebral vascular diseases, and hypertensive diseases. Those if you put them together, you will see that actually majority of the causes are cardiovascular diseases. This gives you an indication the importance of cardiovascular disease in our health. And in Australia, the cardiovascular disease mortality statistics for 2017 showed that 27% of deaths in Australia are actually caused by cardiovascular disease. And if you look at the breakdown, you notice that 43% of these are as a result of coronary heart disease, and 19% as a result of stroke, and then 11% as a result of heart failure and cardiomyopathy. So we'll look in details about all these different cardiovascular diseases and see the importance in our health. Now, let's look at the causes of these cardiovascular diseases. What are the risk factors? Here is a list of the most important factors so far. Yes. The first one is smoking. Smoking is known to be one of the factors that can cause heart diseases. Lack of exercise. And lack of exercise is a good contributor. It's an important contributor to heart diseases. Diet. Diet is very important, especially if those who eat poor diet which is high in fat and glucose. Such diet is predisposes one to cardiovascular disease. Obesity and overweight is also an important factor. High blood pressure and cholesterol, these are the top risk factors related to cardiovascular disease, and we'll look at this in more details. Also, there are hereditary factors. For example, if you look at the family history, there's certain family lines which are predisposed to cardiovascular diseases. Age is also an important factor, because it's been shown that from the age of 65 years and above, people who are of that age, basically have a high risk of contracting cardiovascular disease. Sugar diabetes indeed is one of the key risk factors. Now, how does this cardiovascular disease actually occur? We have looked at the risk factors. Now, in this slide, basically, it's a list of adverse conditions that may lead to cardiovascular disease. And then if you look at the top two, which is atherosclerosis and hypertension, which I highlighted in green, are the most important contributors as adverse effects. And we'll talk more about those as well. And cardiac arrhythmia. Cardiac arrhythmia basically is as a result of irregular heart palpitation. And congestive heart failure. This happens when the heart muscles when they are weakened by various factors, and in so doing may lead to heart failure. And then valvular heart disease basically is a health condition which involves disruption of heart valves, because the heart has got 4 valves. And it has 2 chambers, left ventricle and right ventricle. On each chamber there are 2 valves, and those valves actually are important to regulate the flow of blood. And if those valves are damaged, either by infection or by way of muscle degeneration or tissue degeneration, may result into valvular heart disease. And then the last condition is what we call congenital or infectious causes of heart disease. These are infections that are acquired as a result of childbirth. During childbirth, the baby may get infected, may get the infection from the mother, passed on to the child. And this can happen in several ways. For example, if the mother was a smoker during pregnancy, and smoking can affect the baby development, and the heart may be affected. So it's one of congenital sources of heart disease. Okay, now let's quickly look at atherosclerosis. As I said, it's one of the important adverse effects. What is atherosclerosis? Atherosclerosis basically is a condition where there's a plaque develops in the arteries, blood arteries, in the interior blood arteries on the walls of the blood. And this plaque, which is also called atheromas, is usually developed as a result of cholesterol accumulation. When there's high cholesterol, especially the bad cholesterol in the bloodstream, it begins to adhere to the artery walls. And once it sticks on one particular place, it may begin to accumulate and blocking. It may reach a very severe stage where it can actually hinder the smooth flow of blood. Now, it's important also to know that cholesterol is an essential for the function of the human body, and hence we'll talk about the 2 forms of cholesterol later. Hyperlipidemia is another important health condition which is expressed by, or which manifests as a result of high blood lipid levels. When an individual has got high lipid levels in the blood, this can lead to heart diseases. And this is very significant in conditions such as family history. For example, those who have hypertension and obesity, those who are smoking, those who have got glucose intolerance and renal impairment. You find that this is manifested much more. Hence, it's important to understand the desirable or recommended lipid levels in the blood. And below is the table, which basically shows various types of lipids found in the blood. The first one is called LDL-C, basically, which stands for low density lipoprotein cholesterol. This is the bad cholesterol, and the recommended level is, it must be below 2.5 millimolar per liter, and then followed by HDL-C. This is high density lipoprotein cholesterol. This is the good cholesterol, and it needs to be above 1. And then total cholesterol needs to be below 4. Triglycerides, which are saturated fatty acids, these are not good for the body. They need to be below 2. So these components are important, and these figures are important to compare when you carry out blood tests, to compare to the patient's outcome. That will give you an indication as to what is the real problem with the patient. Now, more about atherosclerosis. It's a sense that basically once cholesterol begins to build up in the walls of the arteries as the major contributor to the plaque, actually it immobilizes other substances such as collagen and the monocytes, which are mobilized in those places to increase the buildup. And as you can see on the right, you can have mild atherosclerosis, and after some time, this actually will build up to a severe state. In the severe state, the end result is that there is extreme hindrance or blockage of blood flow, because the artery size actually reduces significantly. And the other thing is that when this happens during this process, usually the patient or the individual does not exhibit any symptoms. Usually the symptoms happen drastically when it reaches catastrophic blockage level, and this we'll talk more later. And okay, in this slide, basically this slide talks about the two major cholesterol types, the good cholesterol and the bad cholesterol, and basically how they interact in the blood. Okay, let's move on and look at the various types of hyperlipidemia. Hyperlipidemia basically is levels of lipid in the blood above the desirable level. And there are basically 6 types of hyperlipidemia, and the most important ones are the 3 indicated below. So I'll just talk about a few examples. Just to give you an example, the type 2A. Type 2A basically is a type which manifests as a result of high cholesterol and low density lipoprotein cholesterol. And the second one, which is 2B, is brought about as a result of high VLDL, which stands for very low density lipoprotein cholesterol, and LDL. So you can see the various combinations of different types of cholesterols may bring up different types of hyperlipidemia condition. Okay. Now it's important also to know exactly the clinical manifestation of atherosclerosis. Atherosclerosis is presented in a condition called angina pectoris. Angina pectoris is is the end stage is a very severe manifestation of chest pain, usually on the left side of the chest, which the patient actually experiences, and it's very excruciating pain, very disturbing pain that basically it affects the patient drastically. Cannot do anything at all after when the pain starts, and once this pain is induced, the patient needs to be attended to immediately, because what it means is that the atherosclerosis level is too extreme. There is a blockage of the heart artery, meaning that there is very low oxygen being supplied to the heart. And if this is allowed to continue for a short while, the heart can simply collapse and seize and into what we call heart failure, and the patient will die. So it's important to understand this is a very serious condition, and it needs to be attended to very quickly. There is another form of angina, which is also called unstable angina. This can happen periodically depending on the condition of the persons. There are times when, depending on the living condition, the person may experience mild chest pain, sporadic chest pain, when there's periodic or poor flow of blood to the heart, and which may result to low oxygen in the heart. And this is not protracted. It's just for a short period. Usually when you're in a sitting position, it stops. And so these are two forms of angina. And just to give you more information about angina, what will happen is that when the arteries are blocked, basically they block the flow of blood into the heart. As you can see on the picture here, on the left is the normal left coronary artery. If you look at the blood vessels are well distributed, but on the right side, if you look at the arrow, where the arrow is indicating what we call artery stenosis, this is where the blockage of the artery is, meaning there's very, very little blood passing through there to the heart. And this would bring about, weakening of the heart as a result of low oxygen supply. Stenosis, that is the condition of the artery. Now, so when we have patients that have shown to have hypertriglyceridemia, which means they have high lipid levels in their blood, yes, one of the ways to control or treat these patients is by use of drugs. A couple of drugs that have been recommended, for example, vibrates, nicotinic acid, acipimox is some of the drugs, and also fish oil. Fish oil is from the famous omega-3, and it either can be obtained through fish, eating a certain type of fish, or you can buy these tablets, omega-3 tablets. Now, how do these drugs work? Mainly, they work by a process called lipolysis. Lipolysis is a process which degrades fats and reduce the concentration of fats in the blood vessels. Okay, and that brings us now to hypercholesterolemia. This is a condition when a patient has got high cholesterol in the blood, and this can be controlled by a group of drugs known as statins. Statins are one of the best groups of drugs that are highly efficacious, and they treat such condition very well. And how they work basically is to inhibit the HMG CoA reductase. This is an enzyme that catabolizes the cholesterol metabolism. Yes, it's responsible for regulation of the cholesterol metabolism process. And what these drugs, statins, do basically is by blocking this enzyme at the limiting rate stage, which is the mevolate stage of the pathway. And by so doing, they reduce the cholesterol levels and improve the condition. One thing to know is that these statins have got antiplatelets and anti-inflammatory effects. As you know, platelets are responsible for blood clotting, and in certain conditions they may render, they may reduce blood clotting capacity of the individual and lead to bleeding, excessive bleeding. Okay, so here's just a list of those drugs, statins. We have simvastatin, atorvastatin, pravastatin, flavastatin, rosuvastatin. These are very common drugs, even in South Africa. Especially simvastatin is very common among the public hospitals and health centers. I think one of the reasons is because they're affordable and they're very effective. So below there's just a study that was conducted. I'm not going to go into detail because of time, but you can read this at home at your own time and just understand how the trials were used to determine the effectiveness of these drugs. Okay. Next is aspirin. I want to talk about aspirin. Aspirin, besides being an analgesic, which is a painkiller and also reduces fever, it has additional benefits. It's been shown that actually it decreases the risk of vascular diseases such as heart attack, stroke, and cognitive decline, and some cancers. However, there are adverse effects when you administer aspirin to patients. One of the risk factors is risks are increasing in GI ulcers, hemorrhage, and anemia as a result of bleeding. Also, they can be responsible for stomach cancer. So it's important to be aware about these adverse effects. Now, how do aspirin work? What is the mechanism of action? Aspirin basically belongs to a group of drugs called NSAID, which stands for non-steroidal anti-inflammatory diseases, or drugs rather. And aspirin reacts with an enzyme called COX irreversibly. So there are two forms of these enzymes. There's COX-1 enzyme and COX-2. As you can see on the right there, how this enzyme catabolize or they regulate the production of prostaglandin, various types of prostaglandins. So by blocking these enzymes, actually, for example, if you block COX-1, actually there's reduced or blockage of prostaglandin 1, which is responsible for maintaining stomach mucosa, the lining of the stomach. So as you know, the stomach is acidic, and if the stomach lining is not well maintained, there could be damages to the mucosa, leading to ulcers. And also blood platelets, production is impaired. That can lead to bleeding. And then if you look at COX-2 inhibition may lead to reduced inflammation. So these are some of the, and then also we have, as I said, side effects which we need to be very much aware each time we prescribe medications. It's important to be aware about adverse effects. Okay, Now, let's look at blood pressure. As I spoke earlier, that atherosclerosis and hypertension are the two major adverse effects or adverse conditions that can lead to heart problems. Now, it's important to know that actually blood pressure is centrally controlled by the body itself. It's by three systems. First is the nervous system, and the second is the adrenal system. The third part is the kidney. So these three systems work together. For example, the kidney system is responsible for regulating renin. It's an enzyme that is responsible for regulating sugar content in the blood, which also influences the production of angiotensin 2. And if there's a leakage of renin through the kidney, for example, if the kidney is not functioning properly, if there's a leakage of renin, this may lead to increased angiotensin 2, which results to high blood pressure. Also, we have hormones such as antidiuretic hormones. Yes, and these hormones basically influence or regulate blood pressure. And if at your own time, please read through the figure on the right to understand clearly where these systems operate and how they operate, so that you can appreciate it. It's important to understand the regulation and be able to know exactly what really happens when someone is going through hypertension. Yes. Now, having known that, it's important to know that actually hypertension can be treated with drugs, can easily be treated using drug therapy. And there's a first line of drug therapy actually includes the following: ACE inhibitors. These ACE inhibitors basically are angiotensin 2 receptor antagonists and alpha antagonists. Basically, they actually block these receptors. Then you have also have what we call beta blockers. These are different types of drugs. We have calcium channel blockers, diuretics, and endothelin receptor antagonists. Now, on the right is a diagram that shows exactly where these drugs operate in the body to regulate, to control hypertension. At your own time, please take time to read through it and understand how it works. Okay, let's look in detail basically how alpha antagonists operate. Basically, alpha antagonists bind to alpha-1 receptors of arterioles and venules. These are small blood vessels, and by doing so, actually they reduce the vascular resistance, which is the resistance on the blood vessels. They make the blood vessels, they relax the blood vessels to allow blood to flow in higher volume. Yes. So basically, with this kind of drugs, there are side effects. One of it is hypotension, which is reduced blood pressure, nasal congestion, pupil constriction, and fatigue. So it's important to be aware about this. And also, there's a very common problem, which is when you administer such drugs. The first dose, usually the patient will experience hypotension. This needs to be known, so that there's no alarm by the patient. Patient needs to know this. The second group is beta blockers, and beta blockers, the main feature is that beta blockers are used for preventive purposes and not treatment. Yes. How they work basically is to reduce the heart rate and the force of contraction. As you know, the heart has a certain force, contraction force, that allows the blood to be pumped out of the heart to the rest of the. Now, these beta blockers, basically, they reduce that force and the heart rate. By reducing that, actually, they reduce the oxygen demand for such purpose. And that's how basically they are able to control blood pressure. And also, if you look at their mode of operation, basically, is they bind to beta receptors, which result in the decrease of angiotensin II formation and aldosterone secretion. So these are important, systems. And also, it's important that the beta blockers, they take a while to be effective. It may take 1 to 2 weeks before they can see any relief symptoms. So it's important to know this. And also the side effects that are caused, for example, insomnia and vivid dreams are some of the side effects that may occur to certain patients. Okay. Now, with calcium channel blockers, there are 3 examples. One of, for example, amlodipine. These are drugs basically that once they block, calcium channels, they actually lead to coronary artery dilation. They dilate the coronary arteries, and they reduce the force of contraction on those on the heart. And this is how they are able to treat, hypertension. Yeah, and the one important feature when you use calcium channel blockers is that when stopping the treatment, it must be stopped gradually. So gradually and not abrupt. If once stopped abrupt, there are actually severe side effects when stopped abruptly. Okay, and how they work basically is that the blockers basically close the receptors and the channels are closed. When the channels are closed, basically they reduce or decrease the entry of calcium into the cells, and they also reduce the calcium availability in the heart and the blood vessels, and that actually leads to reduced contractility, conducting, and valvular tone. So yeah, this is how they operate. Okay, so let's look at the next group of drugs, which are called peripheral vasodilators. Okay, so these are specific drugs which basically target blood vessels in the peripheral part of the body, which is the arms and the legs. These are smaller veins, blood vessels, and once administered, they dilate those vessels in the arms and legs. If they are dilated, actually they reduce the strain on the heart and other vital organs. Basically, these are groups of nitrates, and once administered, basically they are converted to nitric oxide. It's the nitric oxide component actually that causes dilation of vessels. 2 examples: glycerol trinitrate and the isosorbide dinitrate. Those are 2 examples of peripheral vasodilators. And on the right, basically on the diagram here, you can see the various side effects of such drugs. For example, nausea, dizziness, headaches, vomiting. These are some of the side effects that may occur when patients take such drugs. It's important to be aware and monitor. Now let's talk about diuretics. Diuretics are drugs that actually lower blood pressure by decreasing the blood volume. Remember, I spoke about antidiuretic hormones. Antidiuretic hormones are responsible for regulating blood pressure. How they do that basically is by maintaining the water level in the blood. Maintaining the water level in the blood. So with high blood pressure, one of the ways to reduce high blood pressure is to remove some of the water in the blood. So the role of diuretics is to draw out water from the blood and reducing the blood volume, and hence reducing the blood pressure. So basically that's how it works. And that brings us to the end of the drug therapies. And then it's time now to talk about non-drug therapies. There are basically three important non-drug therapies. The first one is called coronary angioplasty, also called as percutaneous transluminal coronary angioplasty, PTCA. This technique basically involves introduction of a catheter. It's a small device that is introduced in a non-invasive manner. There's no surgery involved. It's introduced into the blood vessels and allowed to go to the plaque area. And once in the plaque area, basically the balloon is inflated and it pushes the plaque aside, creating space, increasing the blood vessel space. And once the balloon is deflated and removed, it actually leaves the blood vessel open and improves the blood flow. Basically, that's how it works. And the balloon catheter is actually removed afterwards. Okay, now let's look at coronary stenting. Coronary stenting is one of the non-invasive methods of treating atherosclerosis. Yes, and basically it's similar to angioplasty, but in this case there's a wire, or rather a metal mesh tube that is inserted into the artery, the region where the plaque is. Once inserted there, the balloon is inflated to expand the mesh, and once it's expanded, the balloon is deflated and withdrawn. The wire mesh is left in that position to open up the blood vessel and allow the blood to flow freely. So this is routinely used in patients with angina or myocardial infarction. So the very, very, very interesting technique actually. Here's just the drawings that indicate how the stenting deployment is done and the end result on the right side. Then the third therapy is actually a surgical therapy. So it's a surgical therapy called coronary artery bypass grafting, CABG. As you know, surgery is a very risky procedure, and it's only reserved to patients that have got extreme condition. And so the patients that are recommended for such therapies is that these are patients which have not responded to the previous therapies. For example, the drug therapy and the PTCA methods. If these methods are failed, the last option is to use surgery. And in this method, basically it involves grafting an artery. For example, an artery can be removed from one part of the body. For example, the chest. In this case, an artery was removed from the chest and introduced into the heart, and it was grafted and bypassing the plaque. So, which means the blood was able to move from the artery, bypassing the blood into the heart, supplying the heart. So this is one of the important, surgeries that can happen. Okay, having said that, it's important to be mindful of the different strategies of tackling, cardiovascular disease. We must not wait until the symptoms have shown, but it's important to tackle them at various stages of, for example, the the community. You can look at the general population. There are strategies that can help us to avoid contracting such disease. For example, the public awareness of lifestyle, detrimental lifestyle is important. And also there are certain risk groups, individuals that can be targeted by implementing primary prevention. And if certain groups of people or patients are infected already, we may apply what we call secondary prevention that may lead to drug and surgery therapies. So basically it's just a scheme to help in various levels of strategies. And health promotions approaches are important. Okay, lastly but not least is basically the lifestyle advices that may help to reduce cardiovascular diseases. These are very important practices. The first one is exercise. It's important for individuals to exercise at least 30 minutes per day. And also they must eat well. Food must contain plenty of fruits and veggies, including whole grains. And also they must reduce intake of fats and sucrose. And patients also must reduce weight. If they are obese or overweight, they need to reduce weight. Smoking is not good. The patient must stop smoking. And if the patient drinks alcohol, he must not exceed the moderate level of alcohol intake. So it's important to keep that in mind. And also it's very important to have periodical medical checkups for cardiovascular medication and prescriptions. So that brings us to the end of the talk. I wish you all the best. Take care of yourselves. Stay safe and stay home.